Went through. Look, I'm going to talk very briefly about what is a physiotherapist. However, I believe, look, I think at this point in time, I'll say the Australian Physiotherapy Association will do a far better job than I will now in terms of describing the many areas of which a physiotherapist might work and function. However, in really brief terms, physios work with, across the wide variety of health service and health service delivery in multiple different areas. You go into any hospital, you'll find physiotherapists. On any ward, you'll find physiotherapists in acute, in subacute, in rehab, in home-based settings, in private practices, sports settings, all sorts of things. We'll talk a little bit more about that in just a moment. So physios, we commonly assist, and if you think back to the shrinking of our name, which is physical therapy, it's looking about movement and restoration of movement with an aim to restore function, restore, maintain, or improve function. It shouldn't always be after some sort of injury or health event, but quite often it is. But there's an element of promoting health in order to try and avoid disease and injury, and also trying to improve elevating performance and try and prevent an injury from occurring. So where do physios work? I mentioned this very briefly earlier, all across the health sector and health service, but probably a little bit broader than that, where people don't quite realise. We can see the top photo here is someone working in animal physiotherapy. And I'll tell you what, if you want to make some decent coin, work in the racehorse industry. They'll spend a lot of money on rehabbing racehorses. That said, the most common area will be working in a health setting, working with people. It could be in community centres, it could be across the lifespan of the population, from paediatrics through to gerontology. Very commonly, of course, a very common area that we see is in sporting clubs and sporting organisations. We can see on the bottom image down there, someone working out on a cricket field, and hopefully that sort of flat out position is what we're going to see from the English batters in their coming up Ashes series after being terrorised by the Australian fast bowlers. Some of our graduates work within school settings. It's always very interesting to hear from them and their role within schools, and particularly special development schools. Major businesses and organisations have also run in-house services. There's a lot of things around improving function and improving health. And for those fans of the great Netflix series around Formula One, you'll often see the pit crews down there and working a lot, and a lot of this sort of pre-event getting ready and getting active and getting fit in order to prevent injury, the warm-ups and so on. So what do we need to know about studying physiotherapy here at Monash? And this is specific to studying the Bachelor of Physiotherapy Honours, which is our entry-level program. So we're based at Peninsula campus, although we do have 1 day a week up at the Clayton campus. So that's a great thing for the first 2 years of the program for the students to head up to Clayton. We access the human anatomy facilities up there, which are brilliant. The students also get to experience both elements of campus. The Peninsula's got a fantastic, almost small town feel to it. It's a very social campus in terms of connectedness with other programs going on there, and lots of familiar faces, but also as students get to go up to Clayton, to the big city, the big lights of Clayton, if you like, and spend a day walking around Clayton, as well as accessing the fantastic anatomy facilities. Pretty full-on program. So there's 20 to 24 contact hours per week. Now, the way this is delivered has changed in the last few years. Luke hinted earlier on about how things have changed in all sorts of things in life in the last few years. And so students will have a mix of, currently have a mix of online, on-demand or own time things. So these are typically like pre-recorded lectures, pre-recorded learning activities. But then we'll mix that up a lot with a lot of on-campus in-person classes. So my current first-year students, they come onto Peninsula campus 3 days a week, and they go up to Clayton for that 1 day a week, and they have an online day where we're running live online classes, and that was today on a Thursday. We do have interprofessional learning opportunities, Luke mentioned before, also in terms of the ability for us to run sessions across health professional programs, which is very, very important because that's trying to mirror what happens in the workforce. We don't work in isolation. It's very much a healthcare team, and we try and, as much as possible, allow students to experience that style of learning from and with each other to ultimately provide better health service outcomes for patients. Clinical placements are allocated. You do not have to source those yourselves. We have agreements with lots of major health services within the state. Some students will go down to interstate, we're heading down to Tasmania. Some will go rural as well, but we organise all those for you. And we run a clinical simulation program as well, starting from second year and particularly getting stronger in the third year, which is a fantastic way to sort of run through all sorts of different scenarios and different events where you can control the outcome, but put students under elements of, making them think on the spot, but it is ultimately a safe space. So clinical simulation is a great way for students to learn about how they react and respond in a certain situation. Now, you might be thinking you have a traditional, image of physiotherapy looking after sport, and you might think, well, what do I need to do in terms of clinical simulation if someone might have torn a hamstring? But if someone has, someone's had a stroke and you're in there, it's their first day, and you're in the acute neurological ward and you need to get them up and get them going for the first time, or someone's in intensive care and the physiotherapist will be working in the intensive care unit or in the emergency department and dealing with these scenarios, which are probably in non-common areas where people don't realise where a physiotherapist might work. So we have the ability to practice a lot of those and run a lot of those scenarios on campus before students get out and undertake their clinical placements, which majority start in earnest in the second semester of third year and continue on throughout the whole of fourth year. As per the other programs, there are requirements of all health professionals around police checks, working with children and immunisations. They are fairly standard across all health professions and professionals in the workforce, and it's an accredited program by the regulatory agency. Course prerequisites. Of course, again, you can find all of these online, so there should be no surprises here if you've had a bit of a look at it already. And the same thing with our entrance ATAR is up there on the screen here, and again that's available online. So in 2023, the lowest rank to which an offer was made, which was an lowest unadjusted ATAR score, was at 97.1. We don't know what it's going to be this year. It depends on what the applicants are, but we say students should be aiming for an ATAR of around 97. So what are the pathways into physio? Well, obviously the most common pathway into our bachelor's program is that pathway straight out of high school or secondary school. However, it's not the only pathway. There is people who transfer from other study as well. Obviously, you need to have covered the prerequisite units either at VCE or in subsequent studies after that point in time. So that might be if there's a prerequisite that you need to fill in that might be in biology, that you've done a unit, a tertiary unit that's covering similar sort of learning outcomes. There is no specific degree if you miss out first time around, but you still want to transfer in, which we do encourage people to do. There is no one degree which will give applicants an advantage over anything else. As long as you've met the prerequisites, what you do need to have done is to have done at least 1 year full-time of tertiary studies, and then it will look at what your tertiary marks are and they convert those to an ATAR equivalent, and you apply through VTAC. There is the ability for internal transfers for Monash students. That is to apply for an internal transfer. This is still a competitive process. The base score of that is to minimum of a distinction average across your studies that you cover. However, that is still a competitive process, and it will be based on how other people and what they apply and what their marks are, and also they try and make it almost equivalent to the VTAC process. There is no quota of year 12 and non-year 12 places. So we've got an intake in first year in the bachelor program of about 90 students, with a bit of a split amongst domestic and international students. And within the domestic students, there is no set quota for this is how many we're going to take out of school, and this is how many we're going to take who might have done some extra study. It is based entirely on the numbers, which is a bit of a brutal sport, but it is the way that it works. So we do have tips to say that if you are looking to transfer from another course, to choose a course that you are going to do well in and enjoying, because you will need good marks to bring across. Try and choose subjects that you are going to perform well in, if possible, or if you need to fill a VCE prerequisite gap, make sure you have that covered. And a bit of sort of life advice, choose a course that if you are ultimately unsuccessful in transferring it across, choose something that if plan B ends up becoming plan A, let's make sure that it's not an absolute disaster and that you set yourself up for a decent life down the track. So here we are, here's some of our happy campers on campus here, and Nathan is going to talk a little bit more about what it's like to be a student. Down the bottom left down here on the screen, you can see the students doing the simulation, okay, coming in. So these are, believe it or not, our first year students. Many of them are feeling like that at the moment, heading into their first exam period, but these are the students as they're doing their clinical simulation. And we can just see some of the students as they're undertaking their classes as they go through and smiling very nicely for us. I'll talk very briefly here about the postgraduate pathways. I'm not sure there'll be too many on the line here that this is relevant to them. However, these are for students who have, or for applicants who have completed another degree in another area. So rather than done 1 year or 2 years and looking to transfer, they've completed another degree. And the information of that, if there are people interested on that, you can jump online and have a look at our website and you'll find out further information regarding that, our Doctor of Physiotherapy graduate entry program. Okay, now I am going to, like we've been very privileged to have some fantastic student speakers, and I'm going to hand over to another one who not only is a fantastic physiotherapy student, but by memory is a very talented violinist. Nathan, I won't ask you to break into one of Bach's violin concertos or something. However, what we will do is to ask you share your experiences, what it's like to be a physiotherapy student.
Thanks, Mick, for the introduction. Hi, everyone. My name's Nathana, and I'm currently a second-year physio student at Monash. And as Mick said, I'll just be sharing some of my student experiences today. So I took a very traditional route into entering physio straight after high school. So I just graduated high school and then I just went straight into it. One of the main reasons I personally chose physio at Monash was I looked at the course structure and I really liked how there was a lot of hands-on training and clinical experience throughout the degree. I was also interested a lot in research when I was in high school. So being an honours degree, I thought it would give a lot of opportunities for clinical research. Well, I can definitely say that my expectations were met when I entered the course. Key emphasis from day one was just being a physio. I remember like entering my first practical class in week 1, and I was thinking that surely there'll be some icebreaker activities, but then the icebreaker was doing some history taking with some of my peers that I just met. So although this might sound intense, you get used to it very quickly, and the incredible tutors and physio staff are always going above and beyond and making sure that we're all feeling comfortable and understanding everything. All the tutors are really experienced in a range of different fields, as Mick mentioned. So musculoskeletal, sports physio, cardiorespiratory, neurological, ICU specific, and pediatrics. I mean, who would have thought that a physio would be working in ICU, right? So yeah, I really liked how we're just really immersed in the clinical environment from day one. So when we enter like our classrooms, they're all set up like a hospital environment or clinical environment. So we have hospital beds and like healthcare equipment like blood pressure monitors and IV lines and everything. So although these are like really small things, they make us feel that we're really physios from day one. And we did some cool things like helping our friends walk with like crutches and doing the beep test this year. And we even had some recent simulations, which you saw some pictures about, where some of our friends dressed up with masks as like elderly people with hospital gowns and wigs and everything, and we had to help move them about as if they were in a hospital setting. So another really enjoyable aspect of the course that I really enjoy personally is case-based learning. So every week we basically get a case, and this is essentially like when the patient comes in to see the physio, and we discuss this case with our group, and we then have to research it and come up with like treatment options. And at the end of the week, we discuss the treatment options with our group, and this really helps to improve like our clinical reasoning skills, because we're weighing up whether which treatment is good or bad for which patient. And I guess that really reflects what a physio does in real life. So physios, when you go to them, you go with a problem, and then they weigh up what is the best for you, and they give you the treatment based on that. And if you haven't gathered already, we do get a lot of opportunities to collaborate with the other students in the course, and it's a really tight-knit community because usually it's a smaller cohort, so compared to other courses. So we are a really tight-knit community, and all our classes that we have with everyone really strengthens the bond. All of our classes are pretty integrated, so similar to OT and paramedicine. A lot of our classes, so we have anatomy, physiology, they're all very integrated. So for example, last week we did the topic of ventilation, so how people breathe, and all of our classes were relating to ventilation, so the different aspects of ventilation. So for example, anatomy was about the lungs, and then the physiology behind it was also about ventilation, the practical case-based learning theory. And last Tuesday, I actually went into the Alfred Hospital as well, so that we learned about the different machines that provide ventilation. So the integrated learning style, I guess, really helps us to understand our patients on a broader level, and it helps us to be really well-rounded physios. With all the things that Monash has to offer, it really prepares us and reflects what it is to be a real physio in the real world. And I'm really excited for the rest of my degree. Thank you so much.